For our project, we decided to cover young onset Parkinson's disease and its progressive impact on life, especially speech and communication. We decided to cover this topic because there is such a limited awareness surrounding young onset Parkinson's disease. Parkinson's disease is not typically associated with younger individuals, so symptoms are often overlooked and mistaken for different conditions like stress, which leads to frequent misdiagnosis or a delayed diagnosis. Those who have YOPD live with the disease for a longer period of time, which makes early intervention really important for preserving their independence and quality of life. As SLPs, we play a vital role in early intervention and the long-term care for this overlooked and underserved population. Before we start the presentation, I just want to go over the specific sections that we will cover within the presentation. We'll begin with a brief introduction to YOPD. Then we'll move into the science and epidemiology of YOPD, the signs and symptoms of YOPD, the progression and prognosis of individuals with YOPD, assessment and treatment methods used by SLPs, and we'll end with a conclusion and summary of the key takeaways from the presentation. Young onset Parkinson's disease refers to individuals diagnosed with Parkinson's disease between the ages of 21 and 40. However, some definitions extend the maximum age limit to about 50. While YOPD is typically characterized by the early age of onset, a diagnosis does carry its own set of unique challenges that are typically associated with the stage of life these individuals are in whenever they are diagnosed. Individuals are affected during the prime of their life and productivity, so challenges are typically associated with career development, family responsibilities, and active daily routines. Parkinson's disease is a progressive neurological disorder caused by the degeneration of dopamine-producing neurons within the substantia nigra, which is a key area of our brain that controls movement. Dopamine plays a crucial role in maintaining the balance of neurotransmitters that coordinate the nerves and muscle cells that are responsible for movement. When this balance is disrupted, it leads to the symptoms of Parkinson's, including tremors, slowed movement, and impaired balance and coordination. Research shows that these motor symptoms typically appear after there's been a loss of around 60 to 80% of the dopamine in the brain. In addition to dopamine loss, individuals with Parkinson's disease typically experience a reduction in nerve endings that produce norepinephrine, a neurotransmitter important for regulating automatic body functions like our pulse and blood pressure. This loss contributes to non-motor symptoms like fatigue and blood pressure changes. Also, abnormal protein deposits called Lewy bodies form in brain cells, which are believed to disrupt the protein disposal system in these cells. This failure leads to harmful protein buildup and ultimately cell death. Like all cases of Parkinson's disease, YOPD can be caused by a combination of genetic and environmental factors. Some environmental risks include exposure to toxins, pesticides, herbicides, organic solvents, and even drinking well water. Head trauma or injury can also increase the risk. However, recent research has shown that genetics play a larger role in YOPD cases. Specific genes such as PARK2, PINK1, LRRK2, and SNCA have been linked to a higher likelihood of developing YOPD, highlighting the importance of genetic factors in these cases. In the US, over 1 million people are living with Parkinson's disease. And while it is most common in the geriatric population, about 10 to 20% of those diagnosed are under the age of 50. In fact, around 2% of the 1 million individuals diagnosed with Parkinson's are diagnosed before the age of 40. Each year, approximately 90,000 new cases of Parkinson's disease are diagnosed, and between 9,000 and 18,000 of those are YOPD cases. These numbers highlight the growing need for awareness and early intervention services for younger individuals with Parkinson's. YOPD generally progresses much slower than LOPD cases, but they both contain the 4 hallmark motor symptoms, which are bradykinesia, tremor, rigidity, and postural instability. But these symptoms will appear differently or more frequently within YOPD cases. There are certain symptoms that appear more prominent within YOPD cases, and those are dystonia, levodopa-induced dyskinesia, and motor fluctuations early on in the disease. On the motor side of symptoms, YOPD often includes muscle stiffness, frequent off-time dystonia, and a higher risk of dyskinesias. On the non-motor side of symptoms, individuals often experience anxiety, depression, apathy, tingling and numbness, restless legs, excessive sweating, loss of smell, and over time, psychosis, confusion, and hallucinations. In contrast, LOPD tends to show more cognitive decline and issues with balance and gait earlier on. In YOPD, speech and communication difficulties are usually less noticeable early on. However, they progress gradually as motor symptoms worsen. These changes can eventually affect speech intelligibility, fluency, and prosody, making communication more difficult for individuals with YOPD. Unlike late onset Parkinson's, where speech issues appear earlier and are often worsened by age-related changes and cognitive decline, speech challenges in YOPD are primarily the result of motor dysfunction rather than cognitive impairment. One common speech issue in YOPD is hypokinetic dysarthria, a motor speech disorder. It presents itself as monotone voice, soft or weak voice, slurred or mumbled speech, irregular speech rate, and a breathy or hoarse voice quality. While YOPD and LOPD share many similarities, YOPD can have a more significant impact on quality of life due to the early onset of symptoms. Younger individuals face the added challenge of balancing the disease management with important life milestones such as career development, raising a family, and maintaining social relationships. This can lead to social isolation where individuals withdraw from social settings and reduce self-esteem due to the difficulty expressing themselves, which can affect their confidence. Additionally, the uncertainty surrounding the disease often leads to anxiety as individuals worry about their future while managing symptoms and life responsibilities. Many also experience depression and apathy, feeling sadness, hopelessness, or indifference, which is often worsened by social isolation and the communication challenges they face.
So typically the progression of young onset Parkinson's disease is slower than that of the later onset. This is because younger individuals have better neuroplasticity, and this means that their brains can compensate better for dopamine deficiency that is happening due to the disease. There's also the factor of the differing pathophysiology. So the substantia nigra is responsible for dopamine production, and younger onset Parkinson's disease victims are seen to have a lower rate of cell loss in this region. There's also less accumulation of the Lewy bodies in later onset Parkinson's, and Lewy bodies is where we see the neurodegeneration. Another factor that comes into play is just age. So younger individuals are just overall more resilient and respond better to things like medication. They have fewer pre-existing health complications that also add to it.
Here we will watch 4 videos showing Michael J. Fox's speech progression at different ages 38, 49, 57, and 63. These clips illustrate how Parkinson's disease has impacted his communication over a long period of time, highlighting the challenges that he has faced as the disease progressed. He was diagnosed at 29 years old and he is now 63 years old.
By employing the hundreds of little tricks and techniques, a person with Parkinson's learns to mask his or her condition for as long as possible. While the changes in my life were profound and progressive, I kept them to myself for a number of reasons. Fear, denial for sure. But I also felt that it was important for me to quietly just soldier on. When I did share my story, the response was overwhelming, humbling, and deeply inspiring. I heard from thousands of Americans affected by Parkinson's, writing and calling to offer encouragement and to tell me of their experience. They spoke of pain, frustration, fear, and hope.
Anderson Cooper, AC 360.
1994, but 2 years after diagnosis, where I just got it. I just accepted it. And I realized that, there's an old saying that my happiness grows in direct proportion to my acceptance and in inverse proportion to my expectation. It's just about it. This is what it is. And so now what? And
so once you were not in denial, you think you were happier?
Yeah, absolutely. Because when you can look at the truth of something, then that's what it is. It is what it is. Now you have options. The only thing I don't have a choice about is whether I have Parkinson's. Everything else is my choice. And that's incredibly liberating. That's much more liberating than the physical constraints of this disease are limiting.
What did you know about Parkinson's?
Somebody's grandmother had it. I mean, it was not a thing that I noticed or thought about. It didn't enter into my world. I was a 29-year-old guy.
Did the doctor know who you were?
Yeah, in fact, that's one of the few times in my life I felt like saying, do you know who I am? It's ridiculous. You can't tell me that. This was a case when I just thought, it's preposterous that this is happening to me.
His slurred speech, muscle stiffness, and tremors are the signature symptoms of the disease.
Simply, he said, you have 10 years left to work. They're working on some things. There's some things in the pipeline. And
he leavened it with a little bit of
hope. But it wasn't enough for me. I felt very shocked by it.
Things like degenerative.
Yeah, progressive.
No cure.
Yeah, no cure. All stuff that now is just like irrelevant to me.
When you were diagnosed with Parkinson's, you kept it a secret for 7 years. And, I would think that would be a hard secret to keep. Was there a thought process behind it? Were you just so afraid of being treated or looked at differently suddenly?
Yeah, I'm afraid of the stigma. I'm afraid of, I was most afraid of, because I was a great relationship with you guys, that you wouldn't laugh if you knew I was sick. So I had the same in my head. And finally, we got to it. Everything I did, it was my left hand was really bad. And so you watch all this old footage of me, and I have something in my left hand at all times because it's a resting tremor. If it's resting, it'll tremor. But if you keep it busy, it'll be okay. So you notice everything I did, I had a phone, I had a pencil, I had a hat, I had a small dog, and anything. and it just it got me through for a lot of years. But then it just got to be impossible. The thing that I'm not going to take credit for anything. I'm not taking credit for it. But there's some lady who's been shopping out. Maybe 20 years ago, couldn't go shopping. Couldn't open her bag and from blood or change because nobody knew what was going on with her. And now.
There's multiple factors that play a role when you discuss prognosis of this disease. Of course, age of onset is a big deal. Typically, the younger the age of the diagnosis, the longer they live with the symptoms. There's some genetic factors as well. There's certain mutations that can increase the risk of the disease, as well as determine how it progresses and how people respond to treatment. Speaking of treatment, consistency and adherence with treatment plans and therapy also play a crucial role in managing symptoms. As far as life expectancy goes, this disease is not life-threatening. However, the condition itself can cause complications to arise, including infections, falls, and those things can be fatal. Early intervention is crucial in this disease in order to improve long-term outcomes and overall quality of life. If you start intervention early, the neuroplasticity of younger brains we're able to use that to our advantage. You can also introduce medication. This is subject to the health professionals. They'll weigh the causes of the motor weakness and dyskinesia with the medication benefits and make a decision. But overall, the early intervention is going to be the biggest thing with speech and language therapy, and this is going to help catch the communication deficits early so that the brain can adjust and relearn. When assessing this disease, it's important to take a thorough approach to it due to the fact that younger individuals present differently than older individuals, and just overall, each case is different. You'll start with an overview, case history, patient interview, oral, motor, and cranial nerve examination, speech and voice assessment, cognitive linguistic assessment, swallowing assessment, functional communication, and quality of life assessment. Once you administer these assessments, it'll help you gauge where the client is and what the best course of action for therapy would be. So due to the fact that there's no cure for this disease, management methods are going to be crucial. And that's one of the ultimate goals of speech therapy with young onset Parkinson's disease patients. We just want to improve their clarity, volume, and overall just effectiveness of their communication. And this is in turn going to improve their quality of life. Some methods that we know of are LSVT Loud, which is an intensive program that focuses on improving the vocal components such as loudness, clarity, and they'll do this through guided exercises. Speak Out is another program and just encourages clients to speak with intent and maximize their vocal effort. Targeted articulation interventions are always helpful. Speech 5, this is an option for clients with hypophonia. It's a device that you wear that alerts the brain when vocal qualities are lacking and they need to be corrected. And of course, AAC. So just to conclude a little bit, we went over a brief overview of this disease, the potential causes, signs and symptoms, what progression would look like, as well as prognosis and how we would treat and assess it. Here's some key takeaways. The main takeaway is that young onset Parkinson's disease looks a lot different than later onset, and there's lots of things that distinguishes them. For example, young onset cases are more likely to have a genetic component. They have a higher prevalence of dystonia, and the individuals are more likely to experience side effects of the medication that they would be put on. This disease is also characterized by more prominent motor and psychosocial symptoms rather than cognitive decline. Overall, this disease should be studied and continue to be learned more about so we as speech language pathologists can learn to improve treatment methods and approaches and overall just give our clients a better outcome. Thank you very much for listening.